Osteoporosis is an universal disorder and is commonly seen in the elderly population in India. The definition of osteoporosis, as described by the World Health Organization, WHO, is a disease characterized by low bone mass and microarchitectural deterioration of bone tissue, leading to enhanced bone fragility and a consequent increase in fracture risk. Since the cancellous bone is fragile, vertebral body fracture is very common after trivial injury, which may lead to severe symptoms. Often these fractures may be seen at multiple levels and may need surgical management. Apart from fractures, osteoporosis with spondylolisthesis poses a greater challenge in surgical management due to the higher incidence of implant pullout and failure of instrumentation as a whole. Hence, the diagnosis and medical management of osteoporosis in general, and that of spinal instrumentation and fusion in particular, need to be understood well by the surgeons. At present, the best parameters to diagnose osteoporosis are BMD, bone mineral density, and DXA, dual energy X-ray absorptiometry. A T-score of 2.5 is considered as being diagnostic of the presence of osteoporosis. Administration of anabolic, droperidide, and anti-resorptive, alendronate, drugs for a long period of time improves bone density, promotes bony fusion and prevents screw pullout. Neurosurgeons should give priority to the understanding and learning of the biomechanics of spinal instruments, its metallurgy, designs of pedicle screws, techniques of screw insertion and interbody fusions in the context of the osteoporotic spine. Pedicle screw fixation. The pedicle is the strongest bone in a vertebra, and discovery of the pedicle screw placement technique is perhaps the greatest turning point in the history of modern spinal surgery. However, its usage in osteoporotic bone, although useful, is also extremely challenging due to the poor quality of the cancellous bone in the vertebral body, where the pedicle often fractures during the screw insertion. A pedicle screw should have good pull-out strength to accomplish a good stabilization, and hence, there is a continuous process of improvement in the development of new designs, in addition to the usage of various types of bone cement that may facilitate the firm grip of the pedicle screws in the vertebral body. The techniques of screw insertion also has improved further in order to get a good purchase of the bone with the metal. As of now, titanium is the best metal for human application. It has a good metal-bone interface amalgamation, and the titanium rods are flexible and resist fracturing, unlike the surgical-grade stainless steel. The right selection of screws and a meticulous surgical technique will ensure a good outcome in osteoporotic spinal disorders. Conical and cannulated screws filled with cement are the ideal screws available at present. The technique of attaining a bicortical purchase and an optimum cortical bone trajectory needs to be mastered. Transforaminal lumbar interbody fusion is easy to perform and achieves an excellent interbody fusion. Medical management with anabolic steroids and anti-resorptive medications should be a part of the pre- and postoperative management in all patients with an osteoporotic spine undergoing bony fusion.